You're listening to On the Way Home with your host, Emmy Kelly.
Welcome to On the Way Home, the podcast where we talk about the people, possibilities, and policies shaping the path to ending homelessness. I'm your host, Emmy Kelly. Today, I'm joined by someone who is not just a friend and colleague, but truly an encyclopedia when it comes to housing and homelessness. Alex Cheng. Alex is the Vice President of Programs and Services at Blue Door, and he spent more than a decade building and leading transformative work in our sector. Alex, thank you so much for joining us today. Here on the way home, we start each episode asking our guests, what does home mean to you?
Thank you, Emmy, for having me. I'm actually very curious to see whether or not my answer has changed through the years. I remember answering this question a couple of years back, but when I think about a home, I think that it is more than a physical space, right? For me, it is something that is essential, it is safe, it is grounded, and it provides a sense of permanency, right? It's I think it's a home is where we spend most of our time with our loved ones. I think back about my childhood, and I go to school, and I come back home. It's something that I look forward to, right? I go to work as an adult. There's stresses during the day, and I can always count on coming back home as well to be able to kind of ground myself and kind of de-stress. And I think in that way, I think home also shapes us. I think you take a little bit of you in each of the communities that you're part of. So, as I've journeyed through life, every community that I've moved into has had an impact on the person that I've become, which kind of makes this an issue for those who are not lucky enough to have a stable housing, right? Because you're always constantly moving from place to place and always having to have your guard up because you're constantly in flight mode. But for me, home is more of that essential place that provides you with grounding and a sense of permanency.
I shared this with the listeners already, but Alex, ever since I've come to Blue Door, you have been a pillar, a thoughtful leader, and someone the team can always count on. How long have you been with Blue Door?
Wow, I think maybe too long or maybe not long enough, regardless of how you look at it. But I've been at Blue Door since 2013, which makes it almost 12 years.
Amazing. So being with Blue Door over a decade, you started on the front lines and now you're leading transformative programs. Can you take us back to what first drew you to this work and how that early experience still shapes your approach today?
Certainly. I think like a lot of people in this field, I think my involvement was serendipitous in that it was deeply personal. I struggled in my young adulthood with mental health, primarily anxiety and depression. And I think that experience kind of made me seek out opportunities to kind of get a little bit more involved at that time with mental health to eventually support others. So I ended up at a grassroots organization in York Region, a consumer survivor initiative named Craftsman Center. And from there, I started working with people in a peer capacity. And that's where I first realized that there was a deep intersectionality between health, mental health, addictions, poverty, and homelessness. In a way, it was kind of a crash course into life, but it was also a crash course into, how to work in this field and how to have an impact with folks. I think in a lot of ways, what I do every day in my work, even today, has been deeply shaped by, I guess, the frontline work that started there. When you work in a smaller organization, a smaller nonprofit, and I think you know some of this as well. I mean, you tend to get involved in anything and everything, right? And the connections that you make are with people are at a different level. They're deeply personal, and from that point, I think what I learned there is to have a different perspective on each person. So that person-centered approach. I think that sense of needing to empathize with folks and needing to be part of people's empowerment and accountability. And I think the rest of it is history, right? Because it does influence the way that I approach my work with my team and my leadership at Blue Door. And I think it always allows me to stay grounded and allows me to remind myself and the rest of my team, that we can do that. What we do and the decisions that we make are very impactful to the people that we're around.
I'm just gonna throw in here, you were talking about the relationships we build even amongst the staff. I think that, to your point, there's times and occasions where it feels like we're all down in the trenches together. And I think that builds a lot of camaraderie, closeness, like you said. Do you have a story to tell us?
Well, I think the story is, I want to center it around, I guess, how we work with folks, right? And how I think as a team we always need to be reminded that the decisions that we make sometimes may not seem very consequential, but for the person that's walked through our door, any wrong decision or any barrier that we put in front of them can be devastating. And I think that's what I think we try to share in our everyday work is, at the very least, as much as possible. And we can't be in their shoes, but can we try to think about, what would happen if we had to spend a day in the shoes of the person that we're interacting with, for example, right? And I think this, to go back to your question, I think this work can be very traumatizing because how do you measure success when you see that when you work with people that are constantly suffering, that are constantly washing over their backs, thinking that they've been disenfranchised, and they don't really have a lot of trust with the people that they interact with. And our work is to somehow try to reestablish some of that trust, or establish some of that trust in the short time that we have with them, and in that way, hopefully, have a positive impact. Now, I think as a team, we always remind ourselves that although they may be few, any of the success stories, anytime that we see an individual or a family, move out into permanent housing, and they're now, working, or they're in school, or they were previously unhoused for many years, but now are keeping their own place. Those are the stories that we need to keep we need to keep reminding ourselves of, right? And sometimes, because the work is so intense, we kind of tend to forget. We have it's strange how this work impacts you, right? And it is no surprise that a lot of the times it is the stress that overwhelms, all the positives that we see around us as well.
I'm just going to use the opportunity to share, for our listeners, that ever since I've been at Blue Door, I've been very, very impressed and humbled by the way Alex has always led, with taking a very individualized approach to care, that there is no blanket solutions. Even in times of crisis, when we want bigger, better solutions, Alex will always be the first to talk about the individualized care that's needed, because everybody has a dream, and they're the hero of their own journey. And so we're that part in someone's story if we can support with that individualized care. Alex, you've helped to launch several impactful programs, but one major shift we're seeing is how your team is breaking down the walls between housing and health care. Can you walk us through the thinking behind that integration?
Yeah, I think it's piggybacking around the idea that you just shared, right? I think it's about having that individualized approach, taking, I think, a holistic lens into our work with homelessness and this housing crisis that we are all experiencing. I think service providers, we can't really separate the housing emergency from the adverse effects that come with it, or vice versa. So in terms of our service, we tend to see a lot of people that do not have regular access to healthcare. Some may not have health cards because they may have lost it, or maybe they're a newcomer and they're not eligible, or maybe others haven't seen a physician since they've become unhoused because they're ashamed to share that with others, right? I think when you look at people who are unhoused, they tend to prioritize their immediate safety. As when we're talking about what home means, it's the lack of home, right? That you always need to look over your shoulder because you're never ever feel like you're safe, rather than looking at things like that you and I would be looking at in our everyday lives, like our long term health, like getting a regular checkup to see how our blood pressure is, whether or not whether or not there are other things that are maybe popping up. But when you're unhoused, those things aren't even in the radar, right? When you're unhoused, it is really about surviving each day and each night, and often it leads to people just neglecting their health, which contributes to their lack of stability in the long term. I think the thought process is, how do we provide a pathway for people to re-engage and have equitable access to healthcare, and at the same time, have the healthcare contribute to their stability long term. I think one of the things that we all see as providers of in this space is that we see a lot of people accessing healthcare unintentionally through the emergency room. I think you and I would probably, and our families would probably end up in the emergency if there was something that was very, very wrong with us, right? Otherwise, we would probably go to a walking clinic or we would schedule an appointment. But because of our context at Blue Door, most of our services are based in a rural setting, and having ready access to healthcare has been a challenge for us. We tended to see over the years a lot of 911 calls for folks that experienced healthcare issues while they were staying with us. So that meant a lot of emergency room visits, a lot of re-traumatization, because let's face it, when you're experiencing a crisis, whether or not it's a physical health crisis or a mental health crisis, that three-tier response is traumatizing each time because you have to tell your stories and time again. And if it's a mental health emergency, then there's a different response, right? So that really led us to thinking, well, how can we make that experience a little bit smoother for folks, and that in reducing re-traumatization as much as possible. We already had services available to us through the community paramedicine team here in York, the Seaport team, for many years. But the gap was when they came in, they would see people with the acute issues that they had, and they would make an assessment of whether or not a follow-up at hospital was needed, or whether or not it was something that they needed to then manage on their own in the community, if at all possible, right? I think the difference that we've taken in our approach, as many other communities have as well, come to this realization is, in order to bring health equity to folks, we need to somehow bring some of those healthcare services on site as well, so that people have ready access to them. And this really started with being able to collaborate with wonderful physicians I would say physician that at the time, many years ago, stepped up to volunteer her time to see people at Blue Door, and that really got the ball rolling and looking at what that health equity piece would be, and what that wish list would be for us if we were to establish our own health hub, for example, right? And thankfully, during COVID, we were able to do just that. We saw the opportunity to be able to start a more comprehensive health service. So we dedicated one of our office spaces and converted it into a health room where any healthcare professional can come and be equipped to be able to see folks. Sorry, you didn't lose me, did you? No.
No,
Okay, my screensaver went on, and I totally lost you here for a second. But yeah, it was more about how do we bring those healthcare services to people, and how do we attach people back to primary care, which we saw was a gap for folks. And of course, now with the health hub, we have more comprehensive services along the spectrum. So the paramedicine team has access to the health hub. The physicians have access to the health hub. We have wonderful collaboration with CMHA, York South Simcoe, where we partner on providing an on-site nurse to be able to triage patients to the physicians that come on site. We are working very closely with our local Ontario Health team, the Northern York South Simcoe Ontario Health team, to look at ways in which we can provide services to patients who are unattached, and a lot of those patients are the vulnerable patients that we serve that are unhoused. So I think that's really the goal. Is if people have been disconnected with healthcare, then try to find all the ways possible to be able to ensure that that the capacity is there for people to be able to connect to.
And when you describe those services that come on site, seaport, nursing, physician care, how you've really reshaped the way we think about that support on site, what kind of impact have you seen from these services on people who are accessing emergency housing?
Right. I think the impact is immense. I think when we look at numbers, for example, and numbers that we track, right away within the first year that we instituted the Health Hub, we saw the emergency room visits decrease almost twofold. So you saw a lot of people that may have, we were seeing a lot of people before that may have called 911 in the middle of the night because they had a really bad migraine, or they had really bad pain in their back, for example. And now with the Health Hub on site during the day, a lot of those folks have a person to be able to follow up with during those hours to at the very least make that assessment or continue that care for them, so that a lot of the answers that may come up in the after hours, for example, maybe the pain is part of that recovery process for that individual, and maybe there are medications that need to go along and that they have to have on hand to be able to mitigate the pain, right? Those things were not available before. So we've seen the emergency visits drop. We've also, I think, made a concerted effort to ensure that at the very least, people have the ability to be able to be connected to healthcare post their Blue Door visit. So one of the examples that I'll bring in this is an example from Leader Place, our family emergency housing service. We had a family recently, and I believe it was the mother that she had really unusually high blood pressure, and it was something that was really debilitating to them. Right, and I think when we look at housing in a traditional sense, we would work with the family to look at, are the children in school, are we able to set up some housing viewings with you? Let's work on your budget. But health may not have been at the forefront, because we would ask the person to go and seek their own health care. We would think that all they needed was maybe the connection to their own GP in the community. Now, for this family, the impactful piece was that they were not connected to any primary physician when they came in to the shelter, to Leader Place, and through Dr. Henry, which is one of the doctors that serviced the Health Hub, was able to work with this particular individual on a plan to stabilize her blood pressure in such a way that when she left, she had a plan to manage it. She was then connected to a general physician in the community. And I think last week, Steph, our manager at the Passage House, shared with me that they're doing really well in the community, and they're managing their blood pressure quite well, to such an extent that they're on their way back to teaching French in the upcoming year. So this is one of those examples where there is a crisis where a family becomes unhoused. There's also healthcare factors that contribute to the instability. But now with the healthcare piece at least managed, I think the person has a better chance to be able to get back to the workplace in this case, right?
I was going to ask if you could share a story. That's an amazing one. And you did touch on the data of the first, you said year one incidents where you were referring to emergency services were reduced by about 50%, I believe. Is there more data that shows how this model is reducing pressure on emergency rooms or increasing connections to long-term health supports?
Yeah, but I think when I talk about Health Hub, I also I failed to mention the other program that goes on with Health Hub, which is our InReach partnership with our local hospital. I think in conjunction, the two programs have had great impacts on folks. So the Health Hub sees people that are staying with us. The InReach, we provide personnel to the whole to our local hospital, the South Lake Health, to ensure that people aren't discharged into homelessness from hospital settings. I was just speaking to someone this morning that said that in their community, for example, it's really prevalent that if someone accesses the emergency room and are homeless, they may be discharged once they're seen right away into homelessness. Sometimes in a wheelchair or and so forth, right? And this is something that we were seeing before, but we've made a lot of inroads with the InReach program to prevent. So as a whole, in that continuum of service, we're through the Health Hub, we're looking at how do we have a positive impact and provide health equity to people who are unhoused, but through the InReach program, how do we get to a place where we don't re-traumatize people by them accessing healthcare in the hospital, right? If you've accessed the hospital and you're an inpatient, right, and you have to have a lengthy stay, your housing may be at risk. How do we ensure that once that visit is over, that there is some sort of safe housing awaiting your discharge, right? And if you're coming to the emergency room and you have nowhere to stay, how do we ensure that we explore natural supports, temporary housing, emergency housing, seasonal housing, to ensure that you're getting to a place where you're going to have that safety, at least in the interim? And I think those are all very impactful, I think, pieces or narratives that we see. We also see things that you may not associate with our service, for example. And I go back to Leader Place, and I go back to stories. Children's vaccinations, for example. I think this is something that we see a lot in the news cycle. That during COVID, that cycle of keeping up with your child's vaccination for a lot of families has been broken. Now, with having the Health Hub here on site, we've been able to work with families to ensure that even though they are not housed and they are displaced at the moment, that access to healthcare isn't displaced. That we've had many stories where, or many instances where the physicians have been able to work with the families to keep the children's vaccination up to date. Right, we've had many folks that have benefited on both identifying and managing chronic disease while they're with us at Blue Door. And I want to link that back to, this would not be possible if the services were not available here on site, and people that were coming to us probably wouldn't even think about having the time to even engage in or address these issues. So I think it's not necessarily a hyperbole to say that having the service integrated into what we provide is actually saving lives in the long run, right?
Thanks, Alex. You've touched a lot on how one of the key goals is to help people move from crisis into stability. How is this housing and health approach helping clients make that transition into permanent housing? Like when you talk about our InReach teams and the on-site health hub, what does a successful outcome look like, or what do successful outcomes look like?
I think in the most basic of terms, I'll go back to the initial question and my definition of a home, right? It is being part of a community as well. It's taking a little bit of each community that you've been a part of, and what integrating healthcare into our services mean is that we put another piece in place to ensure that people are moving into a supportive community by ensuring that those connections are there to be had, and access to healthcare is equitable even for folks that have experienced homelessness for a long time, or folks that have been disconnected through healthcare because they've been temporarily displaced, right? I know this term kind of gets thrown around a lot, but it is a wraparound support that I think enables housing stability. I mentioned, I guess the person with high blood pressure who's connected to a family GP in the community. I mean, that is the type of impact that we want to make sure that we have in every individual and every family that comes in, right? To not just work with them to house them as quickly as possible, but it is a holistic approach through that mixture that, for example, the if your family accessing leader plays, that your children have access to proper schooling, that they're able to attend, and that they're able to get all the supports that they need through the school board. But at the same time, if there are health issues that are identified, that we are able to be brokers of that service, whether you're a family or an individual. Because I think, in the most basic sense, for a lot of people, without healthcare interventions, there's possibly no housing, no income, or no stability, because it can be debilitating not to have the supports, or to be ill, right?
Now that you've talked a bit more about housing, you've helped to launch and build out Blue Door's housing continuum. You've launched transitional community housing programs like Abode, Forward, and Inclusion. Can you tell us a bit more why you believe that tailored housing, especially for families, seniors, to us LGBTQ plus youth, are so critical?
Yeah, I think it's critical because we can't approach this work having a cookie cutter approach, right? I think if we approach our work holistically and we look at our work using a person centered, trauma informed approach, we know that everyone's going to be different, even amongst different demographics. But the least that we can do is identify, the high priority demographics that we serve, and tailor some of our interventions to these populations. So tailor the interventions and the engagement. You mentioned inclusion and forward, two very different programs. Inclusion is our transitional housing for 2S LGBTQ youth. Forward is our community transitional housing for individual men who are older. So we're talking about 50, 55, and plus. Now the approach is very different when you're dealing with, let's say, a youth and an older person. You add a piece of being part of the 2S LGBTQ community for inclusion, and for the most part, most of the youth that we've served through inclusion have been trans-identified as well. You add a lot of complexities, and we need to ensure that we have the proper supports in place and the proper teams in place to be able to support the different demographics, right? I think we've been successful for the most part in our approach, in that we take that into account, that we ensure that the engagements are as barrier free and as trauma informed as they can be, and as person centered and as empathetic as they can be. Hence we've been able to look across the different services that we provide, and every time that or as much as possible, if there are ways in which we can innovate and have further impact by tailoring services a little bit more, that's something that we're willing to try, right? And I think that's what makes this type of venture unique for us.
Partnerships seem to play a big role in this model. Can you talk about how collaboration with healthcare providers, community agencies, and funders have made these programs possible?
Well, I think I'll preface this. I probably should have done this from the very start, right? By saying Blue Door is a housing provider. We are not a healthcare provider. So, in order to be able to have an impact on the healthcare of the people that we serve, we need to reach out to people that actually know what they're doing. So these are physicians, these are nurses, these are health servicing organizations that we partner with, and we can leverage their support to ensure that we can each work from the space where we want to provide better health equity, especially for the most vulnerable. So I think for everyone involved, it really starts with dialogue and working from a place of how can we break the cycle of homelessness or of poverty or for the most disenfranchised and the most vulnerable, and really the answer is by working together, right? Because we all of us in terms of we provide services in each of our expertise, but none of us would be able to provide everything for everyone, right? So how do we ensure that we can align some of those services, some of those needs, to ensure that people are getting the proper care and service that they deserve? And I think those are conversations that happen within communities, right? And they're driven. And I think once those conversations start, it becomes more of a no-brainer, because you'll see that there's a lot more overlap than there are differences in terms of what we're trying to achieve and the people that we're trying to uplift.
Looking ahead, Alex, what do you think is the next frontier for housing and health integration? You're a pro at this work. How can communities replicate or support the kind of work that's being done right now that you're talking about?
Well, I think most of our work involves breaking silos, right? And I think that's the biggest challenge, is getting everyone to speak the same language, to identify those common needs, so that we put the people that we're trying to serve at the very center, right? So that services are available to them at the right time or at all times, if they need them, right? I think the conundrum for us is that some folks have higher needs than others, so we have to look at a way in order to prioritize those that have higher needs. So, working from a more equitable approach to say, hey, if we invest a little bit more in providing care and connecting services to folks that have experienced chronic homelessness, for example, that impact is going to be measured in many ways, and it's not just decreasing the access of these folks in the emergency room, but it also leads to hopefully being able to place people in stable housing and for people to live dignified lives of their own, right? And I think when we're looking at community across the country, across the board, in terms of wanting to engage and wanting to lead health initiatives of their own, I think I would go back to your own community and identify, that group of champions that's going to help you move this forward as well, right? And when you do, keep sharing your successes so that others can learn from you. I mean, we're not the first one to do this. We learn from a lot of great folks that have gone through very similar things that we've gone through, and we've learned from them in terms of what has worked. But we've also along the way had to do things differently because our community is set up differently, our services are set up differently, our transit system is set up differently. So I think once you get people together, I think you'll find that there are aspects of your collective work that will resonate and that you can that you can get behind, right? And I think that's the approach to take that first step.
Alex, thank you. Thank you for sharing not only the incredible work happening at Blue Door, but the heart, strategy, and collaboration behind it. I should ask you, in case any of our listeners want to reach out to you to learn more, is there a way they can get in touch?
They can. They can get in touch at our website at bluedoor.ca. They can get in touch with me via email as well, alex.c@bluedoor.ca. So yeah, please feel free to contact me anytime.
It is clear that when we break down the barriers between housing and healthcare, we don't just stabilize lives, we transform them. Thank you, Alex. That was Alex Cheng, whose leadership at Blue Door continues to set a powerful example of what's possible when innovation is grounded in compassion, strategy, and deep community partnership. From integrating housing and healthcare to designing inclusive programs that meet people where they are, Alex reminds us that real systems change happens when we're willing to rethink the barriers we've come to accept. What I love and appreciate most about Alex is his grounded, thoughtful, and careful approach. He ensures the work we do every day at Blue Door isn't just reactive, but is consistent, planful, and intentional. That kind of leadership creates real impact and real trust. Thanks for listening. I'm Emmy Kelly, and we'll see you next time on The Way Home.
You're listening to On the Way Home with your host, Emmy Kelly.